Best doctor for cheek implants? I had a wonderful experience with Restylane Lyft. I would love to have a permanent result. I don't want anything to alter my smile or have unnecessary future surgeries because of movement. Is it unreasonable to think you cannot have the same results with an implant as a filler? I'm located in St. Louis, but would be willing to travel if someone has the experience.
Thank you for your question. You're asking for the best doctor for cheek implants, and you describe in your question that you had a very good result using Restylane Lyft, and that you're looking for a permanent solution. And further, you are aware that potentially you can have issues with the altering of a smile or the possibility of movement related to implants. And you're asking very appropriately, is it impractical to expect the same results from cheek implants that you would get with fillers? And further, you are willing to travel anywhere for this type of surgery. Well, I can certainly share with you my perspective as a doctor who performs cheek implants and uses injectable fillers, and the evolution of my practice with helping my patients who have very similar desires. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Surgery is a very significant part of my practice, and helping people with facial rejuvenation is very much a significant percentage of what I do from a surgical perspective, and that of course includes the placement of various types of implants. Now, as time has gone on in the world of of aesthetic medicine and surgery, we have so many more opportunities to use tools that can be customized to our patients' needs. So to go over what is the distinction on what a cheek implant can do versus what you can do with fillers, you also have to think about what also goes on in one's life when it comes to just the natural process of either facial aging or fluctuations in weight. You see, when you look at the way things were about 20 years ago, we did not have the fillers and the injectables that we have now. And it was naturally routine to think about facial implants, particularly to improve the cheek area, whether it's with a malar, submalar, or combined implant. And it was certainly a great way to improve this area, the mid-face. What were some of the issues? Well, I think no matter who the doctor is that you're looking to find to do an implant for you, if you want to go in the surgical route, every doctor would acknowledge that facial implants, you still have the same potential risks as you described. Issues with facial muscle movement, swelling, symmetry, and those variables are difficult to predict when you have all of these other things that can go on during and after the surgery. The procedure actually is very straightforward, and it can be done technically very well by, I would say, most competent surgeons who are experienced and have been doing this. Now, I'll tell you what appealed to me and what ultimately appealed to my patients as time went on. First of all, at this stage of the field, we have a lot of very good injectable fillers, such as the one you described, like Restylane Lyft. In my practice, what I've been able to do is apply the principles of facial implant surgery and applied them to the injectable fillers. And by doing that, I've been able to do something called structural volumizing. Structural volumizing is using these very good, robust fillers such as a Juvederm Ultra Plus or Juvederm Voluma, placing it at the bone structure level. And this is where there is an advantage, in my mind, of a surgeon like myself to know where to place the filler, since I have the experience of not only doing procedures like facelifting surgery, but facial implants, facial fracture repair, facial reconstruction. You really understand this area and the relationships between the bone and the muscles. What I find particularly appealing as an artist is I'm able to customize. And customization is really controllable to the fraction of a milliliter when you use injectable fillers. And that's a big, sharp contrast with facial implants. Yes, you can modify facial implants. There has been much time in my professional life spent carving and shaping implants. And certainly what we try to do is predict what someone's going to look like after surgery on the operating room table. But we're also dealing with swelling, swelling from anesthetic, swelling from just the trauma of surgery. Unlike that situation, when I'm doing this type of procedure in my practice using fillers, I'm actually able to really obsess on the fine details of the various elements of symmetry. And of course, there is also this opportunity when you are doing facial volume correction with fillers, you can place the volume at the level of the bone, between the bone and the muscle. You can also place it in the soft tissue at the level below the skin. So now you can really sculpt and feather and shape. So I feel that the control that I get with placement in this way easily is superior to what I can do surgically for a large percentage of my patients. Further, I would also remind every patient who is inquiring about the choice of implant versus injectable is that facial volume is continuously changing. And if you're younger, you may get some fluctuations just from weight gain and weight loss. And as you get older, you will see volume loss at the bone level and the soft tissue level, such as the fat and the muscles. So, although you may want something that is, quote, permanent, your face is not in a permanent state. It is continuously changing. And so it is further more desirable in my mind that if you want to really be flexible with your management and the needs will evolve, then injectable fillers has an incredible advantage. Now, it can be easily argued that if you get facial implant, you can still get injectable fillers. But I think there's a certain bias in the person who is getting the facial implant who feels that surgery is a, quote, more permanent solution. And certainly as a surgeon, I can say that surgery is a more long-term solution, but it's not permanent. There is still continuous aging. So I would say that especially when I have this discussion in my practice, I would say that to my patients, the filler placement method of structural volumizing allows the fillers to actually last a year or longer, which means that the, quote, frequency in which someone would come for further injections can be fairly infrequent. But at the same time, it depends on what that individual needs, and that guides how the procedure is done. And one of the most invaluable benefits of this type of approach is the recovery. With an injectable filler, our patients are able to step away with rarely ever have any bruising, minimal swelling, and so they can essentially have no disruption on their lifestyle and busy schedules. And you can really get, not just in the cheek area, but in the jaw angle, the chin, the same technique can be applied and can mimic and look even better than a surgical facelift. So I would say that without looking at a photo, that if you've had a good experience with injectable fillers, consider these advantages of keeping things as they are, rather than trying to do something that is more, quote, permanent, now that you understand all of the variables involved. So I hope that was helpful. I wish you the best of luck. Thank you for your question.